o'clock, call this meeting of the Chelmsford School Committee back to order. Please rise for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. This meeting is being live streamed by Chelmsford Telemedia and posted to the CPS website for interested community members to access and watch. In-person public participation will be taking place tonight in accordance with social distancing and safety protocols established by the Chelmsford School Committee Public Participation Guidelines. Anyone interested in speaking during the public input portion of the meeting had to notify the superintendent's office by yesterday afternoon and been provided with these guidelines and decided time to attend the meeting to speak. If anyone watching this meeting live has questions or comments to share, they're encouraged to email one of us during the meeting. We'll read their questions or comments during our second public input session at the end of the meeting. So welcome to this meeting of the Chelmsford School Committee. First item on our agenda is approval of the minutes from our meeting on August 24th.
I cannot make that motion. I can't make that motion.
I move that we accept the minutes from the school committee meeting of August 24th, 2021.
Second. Okay, anybody have any corrections on the minutes? Okay, all in favor of approval? Aye. Abstain?
Abstain.
One. Okay. All right, anyone have any good news to share?
I do. It's coming in hot off the presses as we go along. So a couple of good things. I mean, obviously, we're back in the second week of school, full swing of everything. And all of our grants are coming in, but more excitingly, we have the second planning grant for the Innovation Pathways at CHS. So that just came through, as well as a second grant for SEL work that we're doing in the school district. So Desi's been really kind to us in terms of giving us the original grants, but then the continuation grants that we need to go on. And I've been told that the first official music performance of the year will be by the CHS band this Friday at the football game. So if you're at the football game, please watch our band. And that was it. That was my list of good news for tonight.
Great. Anybody else have anything they want to share? Okay, great. Okay, so we're now to our first public input portion of our meeting. We have nobody registered to speak about the agenda, but we did have a request by the Town of Chelmsford Diversity, Equity, Inclusion Committee to come and speak tonight. So in representing them, Latasha Dixon has talked to us about the work they've been doing on their committee.
Hello, and thank you for having me here. Thank you to the chair and to all the school committee meeting members. Starting my timer to make sure I don't exceed the 3 minutes. I'm here to speak to you about an upcoming event that we're having here in Chelmsford at the Chelmsford Performing Arts Center. It is a film called I'm Not a Racist, Am I? This film follows 12 students throughout the course of a calendar year where they actually look and examine themselves on their views about race and racism. And they have lots of interactions. Their stories that they tell are very powerful and moving and relatable. These students are high school students, and I wanted to come to the school committee meeting to ask you to please work with the diversity committee to advertise this event, because we really want to start the conversation about race and racism and how we can move forward in this country. And it takes each of us to do this. The other thing that I can share about this film is after the 90-minute film, the film's director will be here live in person to help moderate the conversation. So she is an expert. She has gone all over this country leading these discussions, and we think that is going to make a powerful impact by having her present. If you think back to just 1 year ago, June of 2020, it was CHS students that organized the Black Lives Matter vigil. That spurred the select board to have a listening session about diversity, equity, and inclusion, which is how our committee was created. So I ask for your support for this event on September 29th.
Thank you. Any questions anybody has? Donna?
Is there a particular age group that this is appropriate for?
I've gone through the film, and so have all the other committee members. I would say that it's a parent's choice, but I would at least, in my opinion, do middle school and above. We do want families to come out if they can. We're going to follow the CDC guidelines at that time, but the material and the language, I would say, is for at least middle school and older.
Thank you.
You're welcome.
Great. Any other questions? Okay, well, thank you very much
Thank you
for
very
coming out
much.
tonight and
Thank you.
putting on this event.
You're welcome. I appreciate it, and I look forward to all of you being there.
Thank you.
Thank you.
Oh, I'm sorry, can I ask one more?
Yep, go ahead.
I'm sorry. Is it free?
Yes,
It's free, okay.
it is free.
Pre-registered?
No, no registration required.
Okay, great. I just-
And it's open to Chelmsford and surrounding communities.
All right, great, thank you so much.
You're welcome.
Thank you very much. Okay, moving on to new business.
Thank you. Yes, we're going to jump right in. Item number one, we had previously approved the school committee schedule for the year, but we did add some dates throughout the fall. One for our the governing relationships and the goal-setting workshop that we're going to be working with later in September. And then we have 3 different dates for the diversity, equity, and inclusiveness trainings that we're going to be participating in. Those are all workshop formats. The meeting on the 28th is a 6 o'clock meeting. That's going to be here in the admin office. It is not going to be televised. And then the 3 DEI workshops are going to begin at 5, not 6. Those will also be held here, and those will not be televised. But what I did was update your meeting schedule, just so that we would have that. I'll post these dates up on the calendar, and just wanted to share those with you.
Any questions on that?
Wait,
On the 28th workshop, is there going to be some sort of agenda they're going to put together?
Yes, I'll send it out in advance.
Okay.
So, yeah, there are no reading materials. I figured who would ask me, maybe it was Donna.
Yeah.
There is nothing we really have to study for going into that session. But I did have a conversation with the gentleman who's going to run the workshop. I'm sending him our goals for the last year so he can kind of acclimate himself to those. And then he'll probably send us back a little bit of information to be thinking about before the session with an agenda for the evening. But you won't have any kind of homework to do going into that session. He's going to have it, structured to last. And one of the things he actually talked about, which I thought was a good idea, was actually kind of taking one of our goals and, kind of blowing it out to work on a timeline and deliverables and make sure everyone's on the same page, just to kind of model for us how we could go about doing that going forward. So I thought that was good.
Do you want to include our last self-evaluation as well?
I did.
Okay, so.
Yep. I'm sorry, yeah, the self-evaluation you just did,
Yep.
and he thought that was very informative, just to kind of help him. And then I gave him our goals for the last year or two, just so he could get a sense of what we've been working on.
Great, sorry, I didn't.
Oh, no, I probably didn't say it.
All right, any other questions? Great, all right, so we don't have to vote on anything, that's.
No, I was really just updating it
Yep.
for you, just so you could have the dates in front of you.
All right.
Next item this evening is a request from Nancy Antolini, our food service director, through Joanna Johnson-Collins. So I'll ask Joanna to describe this. Just looking for the school committee's permission to go ahead and post a new part-time position helping out the food service department. So Joanna, take it away.
Thank you. So before you is a request for a part-time school nutrition registered dietitian. So this would be a non-affiliated position. It would be hourly and no benefits, since it would be under the threshold to offer benefits. And the reason for this is, our program is continually growing and continually improving. The menus are getting more diverse, more choices. The students many students have specific dietary needs, and we feel that we're at a point in the program where a registered dietitian could really add a lot of benefits to our community in our menu planning and helping families with nutrition.
This will all be funded through the revolving,
Yes,
all right, so it doesn't come out of the local budget.
doesn't come out of the local budget, correct.
Questions? All right, sounds worthwhile to me, yeah, okay. All right, so we need to approve the position, I would assume?
Correct. So it'd be a motion to approve the posting of this part-time position.
I make a motion to approve the posting of the position for school nutrition registered dietitian as presented.
Second. Okay, any further questions? All right, Donna,
Aye.
Jeff,
Aye.
John?
Aye.
Maria? Aye. Okay, 5-0.
Thank you
Thank
very
you.
much. Third item on the agenda this evening is just a general kind of review of our opening. So as you know, we went back to school last week. It was great to see all of the students back in the classrooms, working with the teachers. Over the course of this summer, and I've said it before, but I don't want to, not say it again. The custodial staff and the building service staff worked incredibly hard over this last year and a half to keep our school facilities in good order, and they really looked wonderful on the first day of school. The contracted cleaners that we use, as well as our own building custodians, really went above and beyond cleanliness-wise to make sure that we were prepared to go back to school. A lot of our staff came in that week before the students came back and set up the classrooms and really put a lot of time into that, so I thank them for those efforts. And it was, like I said, it was just great to walk around the schools and actually see all the kids back in the classrooms with the teachers and trying to kind of return to some normalcy after the last kind of year and a half that we had. So overall, again, really, the opening was very smooth. You always have little hiccups here and there with operational issues, transportation, pickup, drop-off, until people kind of get the routines done. Sometimes you get a little bit of traffic backlog outside schools as people are kind of reacclimating to how much time it's going to take you to get here or there within town. But again, really overall, it was a very smooth opening of school, and thrilled to have everyone back. As we go through some of the items this evening, Linda, on the first slide, I just wanted to take a few minutes, because obviously we are opening. It's not a regular open. We are still opening, with all the different COVID protocols in place. But just because we have been receiving a lot of questions, want to just frame it a little bit on townwide, what's happening with COVID and some of our numbers, talk a little bit about schools and what's happening. And when we get to the school piece, I really need the community's help to work with us on some of the data collection that we need. And then talk a little bit more about programming. And I know Maria had asked at the last meeting for a little information on technology. So Bill was not able to be here tonight, but he was able to put together information that I'll share with you in a few. When we look at the COVID data, so for people watching at home, on a weekly basis now, the state is still updating community level COVID transmission data, as well as vaccination data. So every Thursday, the vaccination data comes out, so I go online and take a look at where our numbers are. And obviously, they don't identify individuals, but they have different groupings. So the school age groupings in Chelmsford are basically 12 to 15-year-olds, and then 16 to 19-year-olds. And that covers just about all of our students. We do have a few students who are older than 19 in some of our special ed programs, but it's a really small number of individuals there. And it really is great to see the numbers as far as vaccinations concerned of our 12 to 15-year-olds, which would largely be our middle school, the 7th and 8th grade students, and even going into 9th grade. At least 74% townwide of those individuals have received at least one dose of the COVID vaccine, and 63% are fully vaccinated, so that they've received their 2 doses. Those numbers, obviously, I'm looking at this weekly, are increasing a little bit each week, which is great to see. So I do think we had a little bit of a, maybe a little bit of a surge towards the opening of school, where people went back to make sure that they got their vaccine. We kind of tracked to make sure that they do go back and get that second dose if they receive the first dose. So you'll see that 63% continue to increase. But overall, we think that's a very good number townwide at this point. Among our high school age students, the 16 to 19-year-olds, 85% have received at least the first dose of the vaccine, and 81% are fully vaccinated. So they either receive the Johnson & Johnson or they have their 2 vaccines in. So that is also a very strong number, and that was in the low 70s just a couple of weeks ago and is now up to 81%. So I'm very happy townwide that, the vaccination rate is relatively high among this group. I think it's only going to increase. Vaccine availability is not a concern at this point. People can go to local pharmacies, hospitals or whatnot to be able to get the vaccine if they need it. So we think that is excellent. I did talk to Peggy Gump, our school nurse coordinator, to see if maybe we'd want to offer another on-site clinic, just to be able to make it a little bit easier for people if there are any traveling issues, particularly at the secondary level. So we're going to talk about maybe sponsoring one a little bit later. We still don't have any word on the under 12s and when they're going to be eligible for vaccine, so that's still a little bit of a time off. But we're overall very encouraged with those numbers that we see townwide on vaccination. If we switch to the next page, and this is where I need the help. So one of the things over the last 2 weeks, we've been putting out our weekly messages to families to kind of welcome everyone back in the district. We need to actually collect the data, and we're hoping parents will share that data with us so that we know if we have a positive case within our school community, who is vaccinated, and how we are going to treat them as far as if they need to quarantine, if they need to test, what they have to do to actually stay in school. And the information sharing, quite honestly, has not been great so far. I'm encouraged that obviously the community level data is very high, but we just don't have that data at the school level. So we really need families to help us with that. I do think it's going to increase a little bit now that we're back in school. Families are filling out their return to school paperwork, so I think we're going to see more and more of this. Even today, I did see a little uptick in Google because that's where the forms are being shared. But to date, at the high school, we only had about 21% of our student body, and we know the high school students are all eligible just based on the age for the vaccine. Only about 21% sharing that information with us. Again, we don't have the individual data from the town site, so we really need families to share the information with us. Again, in the 2 communications we put out, there are links that you can go and actually upload just a copy of your vaccination card. It goes right to Peggy and the nurses, and they're able to go into the computer system and log in so that we can actually verify who's vaccinated from who's not. At the 2 middle schools, again, the numbers are very low. You have to consider at the 2 middle schools, about 50% of the population isn't age eligible yet, but still to be at 9 and 12% sharing the information at this point, honestly, isn't that great. So we do need to get that information shared. Go ahead.
Oh, I'm sorry, I had a question when you're done. I just wanted.
Oh, okay, so we do need to kind of work on that information sharing. As I said, I think people are going to begin to share it now that we're kind of getting back into the swing of things. But what is very difficult is at this point in time, if someone hasn't shared that information with us, we have to treat them as if they're unvaccinated and they're going to be required to quarantine. They're going to have to be excluded from school until they go through the protocol or show us that they have vaccination or that they want to opt for test and stay and to be able to stay in. And we're going to be in a situation, just as the numbers increase, or if we start to get these cases, where if we don't know and we don't have that information ahead of time, we're going to have to exclude and consider the individual to be unvaccinated and need to quarantine until they provide that paperwork. And my concern is that is going to be frustrating for parents, and I totally get that. But we can't be in a situation of putting students in school, just on, kind of a promise that they're going to share information or, kind of an after fact sharing of the information. We need to have it ahead of time so that we know who's vaccinated, that we don't have to worry about, that we just have to keep masks on and monitor, or who wants to participate in test and stay. Because if you participate in test and stay, as soon as you come off the bus in the morning, we need to have you come into the nurse's office, have your test to be able to determine if you can go to class or not. And if we don't have that information ahead of time, there's a limited number of people who are working on this. We're going to have to exclude and quarantine until we can actually go in and proof that system. So I can't, emphasize this enough. We really need families to share that information with us. It is securely shared. It is really viewable by our school nurses who verify all other immunization information we have on students. But we really do need some help in getting that word out. The first time I sent the communication out, kind of the welcome back to school letter, it was lengthy. I did get a couple of comments about maybe people didn't read the whole communication, and they may have kind of lost the fact that they were supposed to do a couple of things in there. So last Fridays, I tried to streamline a little bit and really just talk about we need the vaccination information, and we need to know if you're going to do test and stay or pool testing. It got a little bit better response, but honestly still not great. So I might be sending out some individual communications, kind of one-hit type thing, so that people hopefully read it and get the information back to us. I did meet with the principals today. I met with Dan Hart, our athletic director. Obviously, kids in sports are, we need this information from them as well. So they're also going to be communicating with their families in newsletters, in individual blurbs, just to try to get this information in. So we really do need the community's help on that. Like I said, I'm very happy that overall the community, has high vaccination rates. but unless that information gets to us, we can't make decisions around whether someone can stay, whether they need to quarantine, whether they're safe to be in school. Donna?
Yeah, I want to talk a little bit more about why it is that we need this information.
Okay.
You know, because I'm wondering if some people may be reluctant about sharing medical information. But we already do require a copy of other immunizations. So
Sure.
this would be an example of an immunization or a vaccination that, like those other ones that students are required to have turned into the schools in order to be able to attend, correct?
Correct.
Okay.
Yeah, so like when you register for the school department, there's a whole list of different paperwork that's required, proof of residency, certain vaccinations, and this is typically all handled at that level.
Right.
Again, this is not a required thing at this point in time. Taking the vaccine is voluntary, but we don't have information from individuals unless they share that with us. I think what is going to happen is the frustration that we're going to hear from families is that if we don't have that information, and then we have a COVID-positive individual, and we have to kind of cast the net to figure out who are the close contacts for that individual. Their families are then going to get a letter saying, so-and-so has been identified as a close contact. We don't have paperwork on file showing the vaccination status of, let's say, Jay, and you haven't consented to have Jay participate in test and stay. So as a district, we're going to have to quarantine, we're going to have to exclude that child and go through the unvaccinated protocol. I believe, based on the data in the town, that parents are going to say, well, wait a second, I just didn't fill out the form. I didn't consent. I'd be happy to have them test and stay if they're not vaccinated, or they are vaccinated, they just need to wear a mask and come to school. The frustration is going to lie. It may take us a little bit of time to verify that, because we just can't go on people's word that that was actually done. And I think when we start to see a few cases in the schools, and then there's that reaction all of a sudden of the information coming in, people are going to realize they have to get it into us. I'm hoping that it's not that people don't want to share, because, again, it is secure. Most parents do share this other information with us on vaccines. I'm kind of hoping that maybe people just didn't fully read through the letter and realize that there were things for them to do. That's why we're going to try to hit them up on school-level communications, again, district-level communications specific to, say, just vaccination status, or participating in pool testing, or test and stay, just to be able to try to get that information.
I have one other question.
Yeah.
With regards to having this information, so we have, and I was going to ask actually that this be put on the agenda for the next meeting, because we have that October 1st deadline coming up from DESE, where that was, their date for being able to determine whether or not the mask mandate would stay in place. So is having this information important for us to know whether or not we're meeting that threshold to be able to determine how it is that we proceed with regards to the mask mandates?
Right, so DESE had put out, when they communicated the whole mask requirement for the start of school, that all K-12 schools did need to mask when indoors, staff and students, regardless of vaccination status. And that was going to go until at least October 1st. At the same time, the state wants to evaluate what's happening with data, and, they may extend that, they may not. But one of the things that they had put out, and I have gotten a few questions about this, is once an individual school reaches a certain threshold, and between DESE and Department of Public Health, they set that threshold at an 80% vaccination rate, that if your school reached an 80% vaccination rate, you could petition the state to then be able to not have to wear masks indoors. So we actually have a call tomorrow. I know timing isn't always great on these, but the state had also said that we weren't going to, as a district, have to report COVID cases and follow-up data on even, like, say, test and stay. They've altered course, and we actually have a conference call tomorrow. Now they are going to be collecting that data, which is fine, because we collect the data anyway, and now we'll be able to kind of monitor and track even statewide what's happening. But at this point in time, yes, we certainly can put that on the agenda as an agenda item to talk about. That was the recommendation at the time. That was 3 weeks ago. I don't know if we'll hear anything more tomorrow.
Right.
But we certainly can put that out there to begin talking.
Will these forms help us determine what percentage we have of kids vaccinated in the schools, with regards to meeting that threshold? Like, let's
Yeah,
say,
we'd have no other way of finding out.
right, so people, in order for us to be able to even consider
Correct,
removing masks, we have to have the forms turned in so we know what percentage of the kids have been vaccinated.
correct.
Okay,
Right,
thank you.
and what they had set, oh, just one sec. What they had set was that it was on an individual school-by-school basis.
Right,
Oh, so let's just say it actually panned out. If you had an individual school that reached the 80% vaccination rate, you could petition to not have to wear masks indoors. Realistically, if that stays the course right now, the only school in our town that would be even eligible would be the high school.
Right.
Because at the middle school level, again, it's not perfect, but about 50% of the population isn't eligible for the vaccine.
right,
So by default, it would only be the high school. If you look at the high school, we only have 21% of students reporting that they're vaccinated. Now, we know the number is much higher, just
Right.
based on the town data, but yes, so at 21% self-reporting, we wouldn't even be able to entertain a petition if that was what the committee desired.
okay. I just want to
That
make sure that
help?
people were, yes, 100%, because I just want to make sure that people are clear on that if, you know, because I know that there are people in the community that would like to move towards, you know, not removing the masks, not having the masks in place.
Making it optional.
Right, making it optional, thank you. But we have to have the numbers, you know,
Correct.
in order
Yeah,
to be able to
at this
petition the
point in
state.
time, like you
so-
said, yeah, I mean, we wouldn't even be able to petition.
Right.
Because we don't have the evidence of meeting that threshold.
Okay, great, thank you.
So, in line with this, first of all, the first time you sent it out, I actually do read all of your letters, which I appreciate that you sent. I got emails from just friends that I have in the system saying, okay, I know I saw somewhere I'm supposed to send this information, but where was that? And so I just forwarded your newsletter with the link. It's a Google form.
Correct.
Okay, so there are people who are not technologically savvy or may not have a scanner to scan in that thing, may try to figure out how to take a photo to send it and so on. If there was some way to make it easier so that folks who don't have that access to the technology can just maybe send in the card and somebody makes a copy, if that's what they want to do, with the form filled out. So make it available also as a paper thing that folks can send in. The additional thing I'm going to recommend is make sure for the EL students that these notices are going out in all the languages or that they have access to this information in the primary language so that, you know, they're aware of what's going on. Because many times the student is really the primary contact with all of the information going home that route.
Okay.
So that would be my high recommendation here. And then the second time, your second newsletter, just as a parent, I received it, I thought this is really good. It's focused on two things and two things only, which I already, you know, had read through, so just kind of, but I think it needs to come, as you're saying, directed to school levels. Everybody's going there, we're directing everybody there to ask questions about certain things with COVID. I think probably coming directly from there is a good thing to do.
Yeah, we're gonna hit it all angles at this point. So like even we're gonna be switching over kind of more of that SMORE newsletter going forward, but there'll be a consent box there that, you know, from the district you can access. It's the same link, even though the school principals may send it out, because the information is just collected in one area for the nurses to access. But I'm hoping between myself and, say, Principal McPhee and Parks and Principal Murray at the high school, if they were all sending this out as well, they might get a different audience reading their newsletter or just paying attention to it a little bit differently. So we are going to do that. The other thing to your point on, you know, because you do need, say, because it is a Google form, you need to log into Google to be able to submit the form. I did indicate that if parents don't have, say, a Google address, all of our students in the district do, and these are really upper middle school and high school students. So they themselves can actually, just when they're logged into the system, they can upload the form for their parents, so that the parent didn't have to. That's an option. They also can, again, we're kind of pushing this to be electronic, but if someone is struggling being able to do that, I don't want the cards, because that becomes kind of liability for us to be able to manage people's vaccination cards. I don't want that. But if they make a photocopy of the card and they bring it to their school nurse, the school nurse can upload it into the system. You know, they could bring it to school and make a photocopy. I just don't want to be having them send me a card through the interoffice mail or something. But, I mean, as long as the photocopy of the card gets to the school nurse, we can upload the data into the system. So there are ways of certainly doing that, but I'm just hoping now, if we've got multiple kind of voices hitting parents and students up on this, our increased response rate will start to go up.
I would make one other recommendation. You have one great access this month, which is the open houses at the various schools. And consider having a nurse message and maybe even someone there on a privacy basis. Folks can go up to that office and provide the information, but, you know, one-on-one with a school nurse. But that I always found was one of the best ways to directly communicate with parents and to make sure that all the principals give one uniform message
Right.
at those open houses.
Okay.
Are we promoting it to our students too, especially at the high school level, and with the deans and the principals, talk to them, saying, hey, listen, you know, if you're playing a sport, if you're doing an activity, you're a close contact, you haven't got it in there, you're sitting it out, versus if you have your card in there.
I think the reality is starting to hit,
Yeah.
you know, as we have a case or two, and it potentially could affect people. I think we're gonna start to see a little bit of a better information sharing.
So I didn't know if the coaches were sharing that, or the
The
activity
coaches
moderators.
are gonna be pushing it. You know, when we send an email out through Connect Ed, it goes to student accounts as well. So I don't expect the elementary kids to be looking at their email, but like, the high school students can certainly see it that way. And we don't mind if the high school students actually just upload the card, but like, to your point, they could do a paper form, they could bring it to the nurse. Certainly, we can hit something up on open house, even if people just have a question about that, or pool testing, or what test and stay is. We can work on that.
Yeah, there's been I think there's a lot of confusion about the things that we've talked about in the past, the test and stay, the pool testing, the whole thing, and you know, how it's being implemented, and it's being implemented consistently through each grade level and to outside activities as well, such as athletics. So I think that, you know, I think that people do need maybe another explanation or clarification on what each of those is and, you know, how they're being implemented, as I said. And just a clarification on open house, so that's going to be an in-person open house? Okay, I just wanted to make sure I was clear on that, because I think that there's some people were wondering if it was Zoom or in-person.
Yeah, at this point, it's an in-person open house,
Okay.
traditional open house. Let's transition to the next slide, because that actually kind of talks about pool testing and test and stay. So, so this is data as of yesterday morning, right? Obviously, throughout the day and even today, we did get additional forms in, but I just wanted to set the stage for you as far as the information that we have as of yesterday morning when I came in to put this together. Again, within that consent form, we asked really in the first one, it was for 3 different pieces of information. So the first, we wanted the vaccination card. The second, we wanted to know if you wanted your child to participate in pool testing, which is that the pool testing protocol that we did last year. It's totally voluntary. Once a week, company comes around, works with the school nurse. It's that shallow nasal swab that we even did here as a school committee. The pool goes off to the lab. The next day, you get the results. If the 8 or 10 people that are included in that pool are negative, then everyone is assumed to be negative. If there is a positive within that pool, then those 8 or 10 people who were part of that sample have to come down to the nurse's office and take that, the Binex Now test, and to be able to determine who the positive individual within that pool is. So let's just say there were 8 swabs, you get a positive in the pool, all 8 individuals come down, at least one is going to end up being positive unless it was a false positive with the test. But you'd be able to figure who that person is that then is positive, has to go for the follow-up PCR test. The other 7 individuals can go back to class, and they are not a concern at that point in time. So those are those particular programs. Test and stay is the same test that you would use, that Binex test, on to figure out who your positive person in the pool was. On pool testing in general, we really don't have a great response rate for this year either. So when we look through our schools, say at the high school, out of the 1,348 students, we only have 84 individuals so far, at 6% of the population of students opting to do the weekly pool testing. Now, part of me says I'm not overly surprised if you have 80-something% of individuals who are vaccinated, because the vaccinated people are not the focus of that. But until we get those vaccine cards, it's just very difficult to figure out exactly how many are vaccinated or not. At the middle school level, the percentages do go up slightly. They're similar. McCarthy had about 13% of grade 5 to 8 students. Parker had about 14% of grade 5 to 8 students who want to do the weekly pool testing program. Again, could it be because half of the school might already be vaccinated? I don't know. It's plausible. But until we get that data, we really can't say. And then at our 4 elementary schools, we obviously have as a percentage of the district, we have better participation. Byham had about 19% of the student population. Center had the highest at 25, Harrington at 13, and South Row at 22% of the student population who want to participate in the weekly pool testing. So again, this is other information we're pushing. In addition to my newsletter, the individual schools are also going to be including this information in their newsletters because this is a rolling sign up. So you can sign up at any time and just jump in the following week's pool. We're getting set up at this point in time to actually begin the first round of pool testing the week of the 20th, working with our provider from the state to get that going. So next week is going to be kind of a critical week between the forms that come in for the rest of this week and next week. We'll be able to figure out, who's going to be in our pool for that first round of testing on the week of September 20th. There's no cap, so, we've got 681 students in the district now. We could do 5,000, if everyone in the district ended up wanting to do it. So there's certainly room to keep signing up, and it's really non-invasive. It just gives you a good sense if we have a problem in the school that we need to identify, we need to isolate, and then we need to be able to protect the others so that, school isn't negatively impacted. So we certainly do need to push the participation rate on the pool testing. We've got to get that up, because if we don't, it almost becomes not worth doing. The individuals who are going to be participating in the pool testing are probably not the individuals that I would be concerned about coming up positive. You never know who's going to be positive, but just if history from last year repeats itself, that's a group that's going to pretty consistently negatively test. So we do need to watch that. Any questions on testing? Pool testing before I switch over to test and stay?
Are we encouraging our athletes to enter into the pool testing? Because I know that can be a problem,
Yeah, I mean,
I'd
everyone.
hate to shut the whole athletic team down,
What's that?
I'd hate to shut a whole team down because, someone tests positive and we don't.
Wouldn't if they're vaccinated.
Well,
Yeah.
true, yeah.
I think the interesting thing at the high school level, where the bulk of our student athletes obviously are, is I do believe the majority or the vast majority are vaccinated.
Okay.
We just need to get that information.
Okay,
So that's certainly struggling. If you are vaccinated, then, the state is actually, you're welcome to participate, but they're not even encouraging it. They're really trying to focus their resources towards the individuals who are unvaccinated. I honestly just don't know if you were an individual who didn't believe and want to get the vaccine. I don't know necessarily that you want to participate in pool testing, just anecdotally through some of the conversations we've had with people. But we definitely want to encourage. But there's nothing we can do to, require that.
okay, so it goes back to we really need to get that.
So it really just needs the data piece.
The data.
And then I think, again, this is going to come to a head when students are excluded from school. So if we don't have the vaccination status and you have to quarantine for a week, that's going to be difficult. I think that's when parents and students are going to want to say, well, I'll participate and test and stay. But there's going to be a lag time between when you enroll and when you actually kind of get into test and stay. You could miss a day or two until that's all working itself out. Or if a parent says, well, I am vaccinated, I just didn't share the card. Well, you now have to have your son or daughter out of school until we can get the card, we can proof the information, and then they're able to come back. So it's kind of a timing scenario with some of this. And we are going to have some disgruntled people going through this process. At this point, there's not a lot we can do if we just don't have the data, and we need to make sure that people in school are either vaccinated or are participating in test and stay, so that we can catch any kind of spread before it happens within the buildings.
So before we get into test, I know you're about to explain this, but it is not mandatory, correct?
What is that?
Test to stay?
No, I mean, parents can just pick the total quarantine.
Right, okay,
So that's an option, but you are missing a week plus of school.
right.
So that's the counter.
Okay.
All right, so we good on pool? Go ahead.
Yeah, so essentially what we're saying is, I think, if we want to try and have students stay in school as much as possible, have access to their education, and help everybody receive what we want to give this year, which is the best education we can, right? And in order to do that, we need cooperation, if we can get it, in these two protocols.
Correct.
And the way to be exempted from not being in school for 10 days is you're vaccinated and we know it,
Correct.
although it is a free sharing, it is not a mandatory sharing
Right.
at this time. And in addition to that, we encourage participation in this pool testing. Now, can you talk a little bit about what the vaccinated students are not encouraged or are not being told to go ahead and do pool testing?
Yeah, can we back up for 1 second, though? Because I just don't want people to lose this. The two key elements to staying in school are really, number one, vaccine. So, I mean, highly recommend anyone who is age eligible to become vaccinated. Me personally, committee can have a position on it, but I mean, I highly recommend that. As a second alternative, if you're not going to be vaccinated and you want to be able to stay in school, then you have to opt for the test and stay program.
Okay,
The pool testing is voluntary. That would actually give us an indication if someone happened to be positive, but that doesn't bring you into school. It's if you're unvaccinated or you don't want to share your vaccine status, your only other alternative to be able to come into school instead of having a quarantine for the 10 days is to participate in test and stay. That's the only other alternative you have. So you've either got to share the vaccine card or you have to participate and fill out the consent ahead of time so that if you are identified as a close contact, you can automatically just that next morning go into the test and stay protocol. If not, there is going to be a lag time before we can get all the paperwork processed. You're going to have to be out of school for a day or two until we can get you consented properly and into the system for test and stay.
okay, great. So this exact message, I think, if you can do this at the open houses will be very important. And it is this month. And I think activities at the middle school level in the past have only started sometime in October. So it may not seem as important to people at this time, but it's going to become very important.
Right.
So you definitely want to
think
make sure,
Sadly, this is going to be one of those things that it becomes important when it happens. So
Right.
when the child is identified as the close contact, it's then going to be important that they either give the vaccine card or they consent for test and stay. And again, my concern is just that lag time when students aren't in school that we really want to avoid. So a lot of this is avoidable if you just consent ahead of time, and that's going to be our continued push to get that data.
And test and stay, it goes, all the grade levels are eligible, right? Elementary,
Yes,
Middle-
K to 12.
because obviously elementary can't be vaccinated, so,
It's
right, so
it's
that would be their only
K to
option.
12, that's their only option.
Right, so that's what, yeah.
And really, for the most of 5th and 6th, that's their only option
Right,
right now.
right.
And for, say, athletics, right now, for high school clubs and sports, if we have the theater performance coming up, that group is going to fall the exact same way as the athletes are. If you are identified as a close contact and you participate in test and stay, you can stay in school during the day, you can participate in your after-school extracurriculars, whatever they are. If you don't, you're excluded from both. You can't come to school during the day, and you can't go to athletics, and you can't go to the play or any of the other music groups or clubs that the high school may offer. So it's going to become critical to people, I think, soon.
So I do want to say that I think one of the reasons why we kind of keep on circling back and clarifying is because some of the emails and information that we've been getting over the course of the last couple of weeks is just confusion around, what these different things are, what's mandatory, what's voluntary, what the, what if you don't want to do any of these things? What happens then? Because there are people that are concerned about the vaccine or, don't necessarily want to participate in the test and stay. So what are the options, right? So I think that, I think this is why we keep on coming back, because I think that, I just want to make sure that it's very clear to everyone, what the options are, what the expectations are, what the consequences are, if, you opt to either participate or not participate in any one of these things.
Yeah, and parents don't have to to participate. I mean,
Right.
this is totally voluntary on all fronts.
Right.
You don't necessarily have to share your vaccination card with us. You don't have to participate in pool testing.
Right.
You don't have to participate in test and stay. But if you are identified by the district as a close contact, you then are going to have to quarantine.
Right.
And that is a, 10-day quarantine, and you're not in school during that period of time. That's the option, but that's the only option at that point in time.
And there's no remote learning, so.
There is no remote learning.
It's like being out with the
Yeah,
measles.
This is old school,
Yeah.
pre-COVID.
Chickenpox.
Yep, chickenpox,
Yeah.
You're out of school, you're getting assignments, you're trying to keep along with makeup assignments and things like that.
Right.
But you're not remoting into class, there is no remote option. It's as if you had the chickenpox 5 years ago. You're out of school for a week.
Okay. And then one other thing, with regards to the pool testing, the test and stay, the vaccination cards and all of this, is this happening statewide? Is this like a DESI recommendation? Are these the DESI guidelines, CDC guidelines,
This
I know they're, certainly we've adopted them, but they didn't come from us.
No, so the state, Massachusetts Department of Public Health and Mass Department of Elementary and Secondary Ed, right, basically take these mandates, or not mandates, but recommendations that come from, say, the CDC or the different federal agencies, and they customize them to Massachusetts.
Right.
So this is the recommendation from Massachusetts, Mass DPH and Mass DESI, basically to keep kids in school
Okay.
and to minimize the amount of time students are away from learning would be, number one, to be vaccinated. That is encouraged. Number two, if you're not going to do that, to do test and stay. That is the way to basically allow students to be able to stay in school. It was proven to be as effective at stopping and minimizing the spread of COVID as a quarantine, because within the school day, again, we have protocols and procedures in place that you may not have, say, in the home or even like the private setting. But we do have masking, the constant hand washing, distancing when you can, when opposed to, say, like in a home situation, you may have your mask off, playing with friends or family members and things like that. There's more close contact outside. So as long as you're coming in, you're testing immediately in the morning, and you're negative for that day, you're monitoring for your symptoms to make sure that you don't become symptomatic, you don't feel sick, you're wearing a mask, then it's proven to be as effective as a quarantine, and you're not missing school.
Right.
So I guess I look at it as options, and
Right.
parents have options to pick from. But with some of these options also come consequences. So that's what we're kind of feeling our way through at this point. But this is definitely a state of Massachusetts, kind of parameters that we're working under.
Okay, thank you.
It's not a Chelmsford thing.
Right, and I wanted to make sure that people understood that this is not just a
we're
district decision. We certainly
Chelmsfordizing it, we're
adopted
kind of
this, but-
customizing it for us.
Right,
But no, this is based on guidance from the state.
right, great, thank you.
All right, if we switch for a second over to test and stay. So, oh, no, same slide. I'm just moving to the right of the slide. So on test and stay, again, our numbers aren't quite where we'd like them to be. So this is certainly something that we need to work on. Now, again, they may not be that high as opposed to pool testing, because we probably do have a significant amount of students who are vaccinated who just have not shared that status with us. And if you are vaccinated, then you do not have to participate in test and stay. But at the high school level right now, or as of yesterday morning, we had about 9% of the students opting that if they were identified as a close contact, that they would like to do test and stay to be able to remain in school and not have to necessarily quarantine. At the two middle schools, McCarthy had 15%, Parker had 18% of students consenting for test and stay. And then again, the slightly higher numbers at our elementary schools, ranging from 18 to 29% of students, depending on the school, who, if they are identified as a close contact. And again, we know at the elementary school, just by default, based on the age, none of those students are vaccinated. That those individuals between 18 and 29% are going to opt for test and stay. We obviously want to get that number to be higher. We want to see, closer to 100%. We're never going to hit 100%, but we certainly want to be on that side as opposed to, the 18 to 29%, because that is going to mean that you're going to be excluding students, having them be remote in quarantine, for at least a week, depending on where the days fall and weekends and things like that. But for an elementary student to miss a week of school is significant. So we don't want to see that happen. We really would like those students to be able to participate in test and stay and be able to stay in school, particularly at this point because we know they're not vaccine eligible. So again, that is something that myself, the principals at all levels, because this includes the elementary as well, are going to be pushing to families, the need for this. And again, I think people are going to realize when it happens to them, when they get that first case in the classroom as a, positive classmate. And again, particularly at the elementary level, in my opinion, we over-identify who the close contacts are because the kids are in the same class together all day. That's when we're going to start to see a lot of families saying, well, I'll consent to test and stay. And there could be a lag time between when you decide to do that and we're actually equipped to provide that test and stay option. So the more proactive that families can be and provide the consent, the better off we all are. It'll just make the whole thing move smoother when we have those identified cases. So that also we're going to be pushing.
Questions there?
Any questions on test and stay?
No, I appreciate your patience on this, but I just want to make sure that, like I said, it's clear for everybody at home.
Oh, no, but this is honestly all we've been talking about, for days. I'm happy to talk about it. And I'm hoping people watching the meeting really do, kind of get the different options because they do have options. But I think as we now start to see cases, and we're going to have cases as we get into the school year, until people are familiar with the protocols, it's going to be difficult. So, no, I think this is good. I have no problem answering the questions. Just as another opportunity for parents to be able to kind of hear it. So, good. All right, so we'll slide off that. Much more communication to come. And that is going to be our push through the rest of September as we try to get our numbers up. Joanna had provided us a little update on student transportation and some numbers. And again, I think overall transportation went off fairly well last week. We did have a couple of hiccups with, particularly towards the end of the school day, some of our runs. Our bus company is short some drivers, and there's a driver shortage, everywhere. So this is not to be, a new territory for us. But particularly for the high school runs, we are having to they're sending some drivers from the Greater Lowell Tech over to help, I think 5 or 6. The buses, I think it was the second day of school, when they were trying to come over in the afternoon, got stuck on, not stuck, but they got hung up on the traffic on the Rourke Bridge, which is brutal at that time of the afternoon. So they end up getting to the high school a little bit late to do their run, and that just sets back the middle school and it sets back the elementary school. So that did happen for a day or two. The elementary schools were able to send out a communication to families, so-and-so's bus is running a little bit late, they're on their way. And I do realize that, the first couple of days of school, that it can be upsetting for kids for that to happen. Today was actually a pretty good day as far as our buses went. It does still take a couple of weeks, just so everyone knows, to kind of get the town familiar with having all these buses back on the road, and again, school schedules and things. But overall, that really did go fairly smoothly. Joanna just points out during a traditional school year, we have about 3,400 riders on our buses. And to date, when she ran this last week, we had a little under 3,200 riders had registered. So we're almost kind of back to pre-COVID ridership. And we did have quite the number of riders add during August, right prior to the start of school. So I know when Peter will be working throughout the course of September to kind of finalize these numbers, look to see if he needs to tweak any bus routes for efficiencies, notify people if the bus routes are going to pick up drop-off times are going to fluctuate at all based on new riders. That'll all happen pretty much between now and Columbus Day weekend. Provide notice to families if that's going to happen. But I think we're actually in pretty good shape at this point as far as like our total number of riders on the buses. Joanna, did you have any additional information from over the weekend to today, or are we still pretty much holding to about 3,200?
I'm still holding, and you can still register. It doesn't end. If you still decide, you don't want to drive your student and you want to take the bus, that's still an option.
Right.
And just to emphasize again, the kids have to wear the mask on the bus, and
Yeah,
the
that's
windows open, and.
Yeah, windows are open a crack on the buses. Masking on buses is a federal requirement. Even after the October 1st deadline, even if that were to go away, masks are required on public transportation.
Regarding busing, one of the things I've been getting some comments on is that in some of these buses, there are 3 children to a seat. Some of them are a bit overcrowded and so on. I don't know if you've been getting these kinds of comments. and what the requirements are. Are there set rules for this? And is it set by the bus company? Is it set by us? How does that work? And who would people directly address their concern to regarding what's happening on a bus?
Yeah, I can tell you, I personally have not received one inquiry about an overcrowded bus this fall. So if people do have concerns, I mean, the first person they should reach out to is really Peter in the Transportation Department.
Okay,
Peter can take a look at how many students are on individual runs or assigned to buses. We can certainly do that. Not trying to minimize this in any way. We wouldn't want to have too many students on a bus. A lot of times, you know, particularly say at the elementary school level, because the kids are a little bit smaller, they on their own will sit on a bus seat with their friends. So it's not unheard of that, you know, 3 kids can sit on a bus seat during
Yes.
a school year. And they very well may just jump on a bus seat with their friend. But what I would want to know is the bus number, so that we can look in the system to actually see how many students we have assigned to the bus if there is a concern. But personally, I have not received one complaint as of going into this meeting.
so let's say there are 3 students in the elementary level just sit together. You know, they're just being nice to each other and they want to be together. Is there someone that says only 2 to a seat, or what happens? What are the rules?
No, I mean, for all practical purposes, on a large school bus, when the kids get on and they're walking down to find the seat, the bus driver is focused on driving the bus. And if a little, you know, elementary school student jumps on a bus seat, you know, sitting next to their friend or whatnot, the bus driver isn't policing that. So, I mean, unless, you know, legs were hanging out into the aisle and things like that, if 3 little bodies kind of sit on a seat together and they're not hanging out, it probably wouldn't be picked up. So the students, you know, parents could always talk to their student to say, you know, if there is an available seat, please go sit by yourself. You know, please make sure you're only sitting with 1 person, not 2. We don't have someone on the buses policing, you know, kind of who is sitting where, or if 3 little kids jump on a bus seat instead of 2. Again, the bus drivers are focused on just driving the buses.
All right, so parents should have that conversation with their kids, you know,
I
trying.
would, but I mean,
Right out.
again, if there's a concern about like the numbers.
Right.
And I'm just saying historically, when we've
Right.
looked into this in the past, or if we pull the bus tape to kind of
Right.
see what's going on.
Yep.
It's just, oftentimes the kids will sit next to a friend.
Right.
Or a cousin or someone like that. And little kids on the elementary runs, you can fit 3 students on a bus seat.
Right.
But I would want to see that there's enough seats to have the 2. Historically, that's proven to be the case, but I'm always happy to look into it. If people just reach out to Peter, you know, we can pull a bus tape if we have to and actually kind of see where the kids went that particular day. Or if he looks at his run sheet and there's only 45 students on a bus, and we know it has a capacity of closer to 80, then it's not an issue of not having enough bus seats. It's just kind of having the students, the children work with their families or the mother or father saying, you know, we really want you to make sure you're only sitting with 1 other person on a bus. So even though it might not be a friend, you know, pick a single seat or don't triple up, just double up at most.
So start with the conversation, and if it really is crowded, then they should definitely reach out to Peter. And
Absolutely. Yeah, no, that's
I
fine.
think that, I'm sorry, I'm gonna say, in general, I think that some of the confusion, and, you know, and eventually, I'm sure at some point we're gonna talk about lunch tonight, but we're putting all these, you know, guidelines and protocols in place to prevent, you know, an outbreak.
Right.
You know, then it sounds like, you know, I think sometimes parents feel frustrated because some of these things that they're hearing from their kids flies in the face of everything that we're doing.
Right.
And I think we need some clarification around that. So I think this is where the busing thing came from. You know, and if it really is an issue, thank you. I think that they should reach out to Peter, and we need to find out, you know. I know,
Right.
I don't, are we running all of the buses we typically would have? Because I know that they're short on bus drivers, so.
We're still running the 29 buses. The capacity is between 77 and 83. I looked at the number of students per bus a couple weeks ago. I don't think any bus had more than 65 students on it. So, and like Dr. Lang said, it's typically less than that, like in the 40s or 50s. So they could spread out if they choose, but like Dr. Lang said, sometimes they just want to sit with their friends. So I don't think it's a physical capacity thing within the walls of the bus.
Okay,
It's just the student behavior.
all right. So we'll work on both.
But I would have parent talk to the child first.
Yeah.
If there really is a concern, please, let Peter know. We can pull those numbers. As Joanna said, just see if there's even an issue on the ridership.
Right.
If there isn't, then that's more of just a conversation with the child. If there is, we'd want to know about that.
Right.
But when we look at we don't over enroll or over subscribe
Right.
students to buses.
Thank you.
I think it's extremely difficult. I mean, because these little kids want to socialize with each other.
Right.
And you can tell your own child as often as possible, only sit with one other person. But then if there are others who just go ahead and try to do that in a bus, then you basically don't have too much control over that, so. And I think that's what parents are basically saying, and I understand this. I mean, I've seen little kids touching each other, hugging each other, and so on, because they just miss one another, and you feel really bad that, COVID is impacting that ability to socialize, and the bus is always one place where lots of socialization
Right.
does happen, as well as the playground, so, and, in normal times, you need to keep an eye on what happens on the bus, and now it's even more difficult to keep that control. But we can't have overcrowding. You're watching that, which is what is important and what the requirements are.
But again, if there is a concern, the parent should just reach out, but I have not received an email. So
Okay.
they should reach out ideally to Peter, but then, if someone's not satisfied with something, usually they reach out to me, and I haven't received those inquiries.
Thank you.
Okay, anything else on transportation? Good to see the numbers back up.
Yeah, we're getting right back up to pre-COVID numbers, which is good. All right, moving on, and again, Maria had asked at the last school committee meeting, just for some updates on technology and some of the new stuff that Bill Silver and the technology group deployed for this year. He wasn't able to join us tonight, but just gave me some talking points for you. I did email you just a little bit wordier document with some description on this for you. But just for the viewing public, the tech group worked really hard, over the summer. A couple of the things that we do have to get the year going, which I think is very notable. But all of our different classroom learning spaces at this point in time are equipped fully with one of those interactive clear touch panel TVs. They all have a Chromebox, a webcam, and a microphone on them. So we now, that was a significant amount of money and resources over the last year and a half to upgrade and provide that in every single classroom. So that is the case. His group deployed over 1,000 new Chromebooks for the one-on-one initiative in late August to families. Again, those went to all of our 5th and 9th grade incoming students. He was able to take all of the some of the extra extra Chromebooks we purchased last year and some of the stuff that we had in stock on carts and basically bring them all in, clean them up, and redeploy them at the elementary school level. So there's now over 100 mobile carts at the elementary level. So each homeroom has access to their own cart, so they don't have to check in, they don't have to share anymore. Whenever the teacher decides to do some type of an interactive lesson where the student would require a laptop, again, at the elementary level, we do not have the students bringing the laptops back and forth with them. They stay in the school. But every school now has a dedicated cart for their classroom, and that's going to be very helpful for us too, like say testing-wise. So they'll have that access and resource. So I think that is excellent. His group brought in all of the devices last year that were deployed for the one-on-one initiative, cleaned them all up, redeployed them for this year. That was over 5,800 devices, just shy of 6,000 devices that had to get cleaned and prepped to go out to the schools. That was a huge undertaking. Bill wanted to standardize on the document cameras that we have in the schools. So we have new document cameras in all of the classrooms, and we now have a standard model. So when it comes to troubleshooting or repairs and things like that, we don't have kind of a hodgepodge of units. We all have consistent documents out there. And we did have a number of older PCs or personal computers kind of at varying ages in the district that were dying off. And all of our teachers now really are becoming pretty adept to using the Chromebooks. But as an extra kind of item with the Chromebook is sometimes you want to work on a bigger monitor and screen and whatnot. Bill was able to provide docking stations for people to be able to, say, plug their Chromebook into and work from, teachers work from a regular screen and keyboard. So that's been very successful. He had about 100 or so of those deployed and more to come over the course of the school year as they catch on. The staff seem very happy with that. And that's a nice kind of extra for us. Next slide. Bill also does have a couple of different funding avenues he's continuing to explore. He's always looking for different grants and things to be able to bring some money in. He has an application pending right now through the E-rate program, which if approved would provide another 2,000 student devices, 200 staff devices, again, Chromebooks. And then one of the things that was allowable in this year's E-rate funding was for homes that don't have internet connectivity to be able to apply for hotspots or kind of Wi-Fi spots. So his application does include 70 of those that we could have in the district at various libraries. So if a student or family needed a hotspot, they could check it out, almost like checking out a book, and take a hotspot home to be able to have the internet connectivity. So we're hoping that that comes through, and we'll know hopefully within the next month or so on that. But he is always looking at that. With some of the ESSER funding too, he's been doing some email enhancements, primarily for staff. We do, like everyone else, get a lot of different kind of phishing emails and things like that, and we want to make sure all of our emails are secure as possible. So he seeks grants to help us in that front. And then lastly, just a couple of the other, this is more for staff. Some of the staff-related items that we have going is a couple of years back when we brought on the whole new copiers in the district. We decided to use paper cut so that staff, because we used to have a lot of like individual little kind of inkjet printers and things everywhere in the district. Using paper cut now, if a staff member, including myself, want to send a document for printing, I send it to paper cut. I walk up to a copier, I swipe my badge, and it automatically prints the document for me. So teachers are getting accustomed to this, but he's adding that technology on all of our kind of laser jet printers, the bigger ones in the district. So really, teachers don't even have to go to the copy room anymore to print their document. They can walk into a teacher's room or an office. So the different laser printers are going to be enabled with this functionality so that you can just walk up to it and print it. I think that's going to go over very well. It's a longer process, though. That won't be completed until after probably Columbus Day weekend, but we're on target for that. We did the third and final phase of the security enhancement update at the elementary schools over the course of the summer. So 2 years ago, we completely redid 2 years ago, we did the middle schools. So they got all new security cameras in their buildings, internally and external. Last summer, we were able to do the high school completely over, soup to nuts, new security system cameras throughout that building. And this past year, we took on all of the elementary schools. So internal, external security cameras within those buildings. All of the different wiring is done at this point. He's got about 90% of the cameras in. But between now and probably, again, Columbus Day is kind of a target. We should have that project wrapped up. But that's excellent because it gives us an internal and an external view of the schools if we ever need anything. We have access, obviously the police department has access to the cameras, and that's part of our whole security system enhancements. And then lastly, one of the things that he's working on is for staff, some enhancements to badges, because our badges obviously say open a door, they help us print at this point. He's also looking to eventually turn the high school students' badges in so that high school students could use the swipe access to get in and out of the school so that the schools could actually stay locked at all times. Also giving the students access to certain machines to go and print so that, again, we're not wasting a lot of paper, but a student could print a job and then go walk up to a particular copier and present their badge and have it print for them. And then lastly, we've been talking a little bit about that new vestibule at the high school to kind of have a secure entrance to the building. That's also going to have a visitor scanning software and be able to print an ID for the visitor who's in school for the day. That'll be rolling out again towards the end of September, that Columbus Day timeline. So Tech has been working really hard on all of their normal stuff that they would do during the summer, but a lot of different enhancements either in place or coming over the coming weeks as well. So Bill wanted to share that information.
So just starting off with this year, we have 1-to-1 for 5, 6, 7, and for 9, 10, and 11. So
That was-
8th and 12th graders are the only ones who don't have the 1-to-1 with the Chromebooks.
Yep.
right now. So
So
that
we-
next year, that will be,
Correct. So when we started the one-on-one initiative 3 years ago, we knew we only had the funding in the district to really support 2 grade levels at a time. And we picked the 2 natural transition points of 5th and 9th grade. So all incoming 5th and 9th grade students received a Chromebook, and they basically, we're on a 4-year cycle to replenish the units. So we did, 5 for 3 years now, we did 6, so you're correct. What Bill was also able to do, though, is we were able to pull in all of the, say, computer carts at the high school and all the extra devices to be able to have enough devices now, even though they're not part of the one-on-one initiative, they're not brand-new devices, but he's redeploying all of the extra Chromebooks that we have in the district so that the current 8th grade and 12th grade students have a device from the district. So really, everyone in the district grades 5 through 12 this fall will have a district-issued device. It's just the grades 8 and 12, because they weren't really part of the one-on-one initiative, don't have a new device. They have a device that was probably either in a cart, because we're not going to need those in the schools anymore, or a redeployed piece of equipment.
and it's in the building, or in the building, so.
No, they pulled in all of the equipment that was in the building, and now he's able to deploy that so that the students can take it home with them and
Oh,
whatnot. So they would have their
okay.
own. I'm just saying it's not a brand-new device. It was a device that was already there.
But it's assigned to the student,
Correct.
which is absolutely terrific.
Correct.
I want to, first of all, thank Bill for the report. I really appreciate it. And I think it's important to know where we are from the beginning of the year, because it'll be a really interesting year to see how technology is incorporated into the regular classroom. And it's, more and more, I'm hearing all kinds of things about, people are really tired from last year, of using the technology and how important the one-to-one in the classroom really is. But it's going to be really good to know in our district how the incorporation of the technology for teaching works. And the fact that we're providing certain things like the homework, the tutoring help, and so on, which can be accessed through the device, and that's the way to access it, makes it much more important to have that technology. So I just wanted to get a heads up on,
Sure.
who's going to have access to what,
Yep.
so that they're all on a
Access really
even
should not
playing
be an
field.
issue. At this point, access should not be an issue. We have purchased, so many devices that we're basically just, on the devices we have, we're a one-on-one district at this point. I really just am of the opinion, and Bill shares this, that we just don't want the elementary kids going back and forth with the device every day. I just think it's ripe for just too many issues and, breakage and things like that. But I think as our kids go on to middle school and high school, obviously they take on some added responsibility. They're going to be on the devices more for schoolwork. It makes sense for them to be able to have the device. So I'm very happy that we're at the point where we really are one-on-one. It took us a few years to be able to get there. I'm proud that we haven't really had to tap any of our local budget for that. We using school choice funding and even just some of our extra funding we've had at the end of the year to kind of support that so that our school choice funding stays. We can reallocate that for something else if we needed to. But no, they've done some very good work.
Just to clarify, so this year's 7th graders, when they become 8th graders next year, then when they're 8th graders, the devices that they've carried through, they go away, they,
Return it.
right, so the lease is over, so we get new devices when the,
Yeah, so every year, Bill basically leases enough to provide, 2 grade levels of students with devices. I want to say it's about 800
Yeah.
devices. So I think for the first year, he deployed the devices. The students ended up keeping the devices with them that year. I believe it was because of COVID. When we weren't back in the buildings, we just left the devices with the kids for that summer. This past year, so they had them for 2 years. This past year, he took them all in.
Okay.
They needed to be cleaned, they needed
Yeah.
to be re-upped, and they were reissued. So the exact same device may not have gotten back to the exact same student, but the device is a 2-year-old
Yeah.
device. And we're on a refresher basically as a district, so that every 4 years,
okay, that's what,
every 4 years, you get a new device.
Yeah.
Or the device is never more than 4 years old.
right,
I guess
that's
if
what I
that-
was
if
questioning.
that
Yeah.
helps.
So those devices that we started the one-on-one with, at the end of 4 years, will become new devices.
Well, yeah, we technically own the devices because we buy them off lease. They might go into carts, they might
Okay.
just be extra computers. but every 4 years, we're on a refresh at this point. So we're going to have new Chromebooks coming in.
Okay.
Basically, nothing has to be more than 4 years old.
Yeah.
You might have a device that still has some life in it.
Yeah.
But, yeah, that's
That's what I wanted to know. Jeff?
I just think this is all wonderful, the printing, the document camera. I was sitting here remembering hand crank mimeograph machines, so it's just incredible how far we've come and what Bill and, his staff do for the students and for the teachers and for all the staff. I think they do a wonderful job.
The last few years especially.
Oh, yeah, it's just incredible when you think of everything that they've done to make what we did last year work as well as it did.
And to reiterate what Maria said, I thank Bill for putting this together in short notice, this is just a sample of what he put together in that report.
These are the highlights.
Yeah,
You
these
know,
are the
and there's a
highlights.
lot more work they do
Yeah.
on a day-to-day basis, even just troubleshooting and trying to help students and staff. But these are some of the bigger highlights he wanted to share right now.
Yeah, it's pretty amazing.
It is.
It's moved along so quickly, I think COVID kind of accelerated this.
Right.
But by the same token, to me, the most interesting part will be how the tools are used, to really get some learning in to students. And that will be the challenge, and our teachers have taken it on, and they'll continue to do it, I'm positive.
Right.
But I'm looking forward to seeing it. It's terrific. Thank you. Thank you again to Bill.
Yeah, you're certainly welcome. I'll let him know.
Anna, any question?
I know we're kind of getting to the end of the school opening update, but I did think we need to touch back upon lunches and have a discussion, because that has been quite a bit of feedback that we've gotten over the last 2 weeks about, spacing, certainly at the elementary school levels, contact tracing at the middle school levels and high school levels at lunches. And, what are we doing, I guess, to make sure that we're having kids be as safe as they possibly can be, because this is the time they've got their masks off.
Right.
And like I said, if we're doing all these other things, but we're not taking care of those things, then it almost seems to just undo all the hard work on the part of our staff and families.
I appreciate that, and I think we're all trying to make the schools as safe as they possibly can be and, kind of mitigate risk throughout this. We're not making them absolutely no, risk whatsoever. We're really just trying to make them as safe as possible. And we do have some constraints around, schedules, the fact that, at elementary, middle, and high school now, we have all students back in the buildings. We are having our lunches in the cafeteria for all classes. I think at the elementary level, even after our last meeting, I know there's been a number of parents who have expressed concern. Most I was really hearing was at the elementary level, I think early on. I haven't gotten too much from the high school level. I've gotten a handful of questions about the middle school level, but the bulk of it was really at the elementary level.
Right.
And I think our principals really did work very hard to make the lunch as effective as it possibly can, given the numbers, given spacing. I'd gotten a couple of questions about Byam in particular, and a couple about Center. And if you think about them, they're two totally different schools as far as the size of their calf. And we even have that issue at middle school between McCarthy and Parker, because they're very different sized calves. But what the principals have done was, within the spaces that they have, at the elementary level, the students are basically eating by class, so they're staying with a group of kids that they are in during the regular classroom during the day. I mentioned I was at Byam last Thursday to kind of just see how the lunch was going. And they were able to actually space the students so that there was a alternating seat. So you'd have a student in a seat and an empty seat, and then a student in a seat going around the calf. So there was good spacing. Students were very good. They took their mask off while they were reading. They ate, and then basically were either going back to class if they'd already had recess, or they were going out to recess. They had some extra seating set up on the stage because they were trying to provide that. They've been working one-on-one with families that had concerns about, now this is more middle school related, kind of having some extra desks around the edges of the calf where if students want to go and sit. Again, at the middle school and high school level, they don't necessarily have to sit by class because they're mixing during the course of the day anyway. And there's a little bit more responsibility as you get older, so that if you want to sit with a friend, or if you want to space with that you can. We have heard those concerns, and again, I do think the schools have worked very well to try to make that happen. It's very difficult to do outdoor eating at the elementary level, just because of the amount of staff intervention and involvement that's required, carrying meals, helping open things. It's inevitable within an elementary calf. But that's where, say, the middle school and the high school, they are working to provide outdoor seating or let kids, students, take their lunch and actually go out and eat if they like to, or just go to an alternate space and be able to eat. So I think that's ongoing. I heard a lot of concerns about that leading up to the start of the school year, and I'd say, not that there aren't concerns, but the number of concerns I'm hearing at this point have really decreased significantly. What I have asked parents, if they still have concerns to do, is to reach out directly to the principal if they need to work on some kind of an alternate arrangement, for their child, if they're not comfortable with the way something's happening in the CAF. We're doing everything we can within the space constraints that we have. Lunch periods have been extended as far as like how long it's taking us to get through lunch so that we can get grade levels in, we can clean between grade levels. There's been a lot of work that's gone into this. I realize not everyone is probably 100% happy or satisfied with some of the things that we've done. There honestly isn't a lot more that we can do, given the resources we have, the time constraints we have, and just the number that we have everyone back in the schools that we didn't have last year. We're still offering our full program of offerings, even though we're trying to eat lunch in the middle of the day.
Is there any chance that we could explore other spaces? Like, I know we have a small lecture hall at McCarthy, for example, or other spaces that may be not utilized on a regular basis that might be available during the lunches. Also, I know you said that it wouldn't be, we have the money to be able to hire additional staff. What about hiring additional staff and using some classrooms with supervision in order to be able to have kids spread out a little bit? I mean, right now, we still have the option of being outside. Unfortunately, it's been great weather for the most part since we went back to school. But it's going to be winter soon, or cold, and kids may not want to go outside, and then that means those people are going to come back in, and where are we going to put them? So, I'm just tossing those as possibilities. I don't know if anybody else has any other suggestions, but, I think that, I think we have to continue to look at this on a regular basis, and I agree with you. I think that if parents have individual concerns, they absolutely need to reach out to the principal so that alternate arrangements can be made.
Right. I think we're at the point, quite honestly, where if people are still concerned, we're on the individual, kind of dealing at this point in time. Money is not an obstacle. Staffing certainly is. We, like every other school system and every other business at this point in time, can't hire staff quickly enough and, retain them to be able to even offer some of these options. Again, like when you look at your, say, elementary and middle school lunch, we're talking a very tight time frame. So when a student comes down and actually goes through the lunch line, by the time they do that, they get to their seat and eat. They may be eating for 10 or 15 minutes, and then they're off to the next activity. These aren't like, kind of hour-long, kids are just hanging around and having lunch. So it is pretty tight and concise. Last year, again, we were running a totally different schedule. You had blocks of time where staff were together with the students, and you might have had some students in a class, some in the cafeteria. I don't even know that those times would work this year. If by the time the students came down to get the lunch and they were then going back to the caf, if that would work. And we honestly don't have the supervision right now to be able to provide that. And I did make a comment previously, like money's not an obstacle. Money is not an obstacle, but you can't attract and retain staff at this point in time.
Yes, 100%.
So that's our issue. I mean, I'm very happy staff-wise that we're fully staffed as far as teaching staff. We're fully staffed admin-wise. We were doing very good, even para-support-wise to start the year. But oftentimes, those are individuals who might be looking to take, say, like a teaching position. So that always happens every summer. It's just that we're more easily able to backfill.
Right.
This year, we're just not at that point.
No, they're just,
so-
across the state, this is an issue.
Even like, say, our day-to-day sub pool is much lower than it normally is.
Right.
Because a lot of our day-to-day subs maybe have assumed, say, a para role
Right.
or a para job because the para moved on to be, say, a long-term sub-teacher. So at all these different levels, we're struggling to really kind of recruit and backfill. Again, I'm very happy that we have the full-time kind of teaching staff that we have now. We're on good front on that. But as we get deeper into the fall and the winter, I am concerned about our ability to attract and retain some of those positions. And I just don't want to set up false hope. that we'd be able to say, come out of the gate and hire another 20 or 25, lunch and recess aides to be able to break up the lunches. And again, I will tell you, I am not hearing from the numbers of people about this, and I'm not trying to minimize that concern, please don't take it that way. But I'm not hearing from the numbers that we were originally hearing about, because I think the schools really have done a good job of trying to meet these needs. But individuals that still have a concern with, say, their child, I really think they need to work with the building principal to see what can be done on a one-off basis, as opposed to like a whole school changing the way that they're doing lunch or recess or something like that at this point.
And I don't disagree. You are 100% correct. It is impossible to find subs, paraprofessionals, tutors, everything. It's just, and I noticed that in our personnel report, some of our, the people that we had hired on a, like as a long-term sub, as a paraprofessional, we've absorbed them now as full-time paraprofessionals in our, right? So, no, I can see that. Yeah, I agree with you. I think, though, that we do have to keep an eye on things, right? Because, as I said, the colder weather's coming.
Right.
We don't know what the numbers are going to do, and I think we have to be prepared with options in case we have to exercise them for whatever reason. So, are we advertising at this point for paraprofessionals or everything? Okay.
Yeah, I mean,
I thought so.
we're, no, and
Page of
even,
the webpage.
yeah,
Yeah, I
even as
know.
people like watching this, I mean, we're certainly looking for paraprofessionals to help us in the classrooms, because oftentimes, if we can't fill those roles, it is, say, like a day-to-day sub that ends up kind of filling the role. If they work out well and they like it, they may get hired to be the para, but then we're short sub. So then we're looking to hire subs. But right now, we're actively looking to fill paraprofessional roles, day-to-day substitute roles. We may even be looking to hire a couple lunch and recess aides, how we have like a 3-hour
Right.
position, particularly at the elementary school level, in the district. So if people know, if people are interested, HR has been constantly updating our website. We use School Spring to attract people to that. I mean, if you know of people interested, it's just we are having a hard time attracting people.
Just with regards to the middle school, so, and the kids, I know that the kids seem very happy about being able to go outside.
Right.
So I think that that's been a terrific idea. But when the kids come into the cafeteria, they can sit anywhere they want. So how are we doing the contact tracing? So that we know in the elementary school that it's by class, but, what if, 2 kids sit down, have no idea who they are? How are we doing the contact tracing?
Most kids at the, again, different elementary than it is middle and high
Right.
school. The kids at the middle school level and the high school level, oftentimes, will gravitate to students that they know, or classmates or friends. In the event that there was a situation, the admin staff would normally go and ask, let's say me and you went to lunch together, and you turned up positive. Then they would say, well, who are you sitting next to lunch for that particular day? I was sitting with Jay and Linda. So, we might be identified as your close contacts as someone to watch. Oftentimes, they can self-report. Oftentimes, they sit with the same people every day, so you get a sense for that. But aside from that, if we ever had to actually kind of prove who was a close contact if they didn't know, we would defer to the security cameras.
Okay.
So we could pull up the video footage from the CAF for that particular day. Not that we want to do this on a day-to-day basis,
Right.
but in a situation where we had to, and we could look at the table and say, yes, Donna, you were sitting next to Jay and Linda, and these guys are your 2 close contacts.
Okay,
So, again, we have the cameras at the elementary the middle and the high school right now.
Right.
And they're used for just, general, kind of help during the course of the day. I don't know that every camera, I can't attest to this, at the elementary level is up and functioning, because again, that timeline is right through like Columbus Day. But eventually, we'd have the cameras at the elementary level as well.
yeah, but
In
they're
the-
sitting by class, so.
They're sitting by class, and they're actually spaced pretty well, so I really don't have a significant concern at the elementary level. But at the middle and the high school, the default would be to defer to the security cameras.
So, because I'm getting the same kinds of questions. So from your answers, this is what I got, and just to make sure people
Sure.
got it too. So first is principal. Talk to the principal if you really are still very concerned that, there's not enough distancing, there's not enough options for your student, and so on. And I'm sure principals are thinking, middle school is quite different from elementary, from high school, and that, thinking about socialization there and so on, and the lunchroom is another great socialization spot. So I'm very glad to hear also that you are using the cameras and keeping those snapshots. In the past, when I think there was an incident, are those daily tapings or whatever you call them of
The video footage.
screenshots, are they kept for a few days? How does that work?
I'd have to ask Bill. I can't tell you the exact cycle. I
Okay.
believe it's like at least 30 days of
Okay,
of footage.
just so to make sure that we have,
Yeah,
have
we
them for enough
certainly have it
time.
for long enough that we would ever have to
Yeah.
look back. I just don't know the exact retention.
Okay.
But I want to say it's about a month.
Okay, great.
As
So
long as it's
we
as long
have
as a
that.
quarantine period, that's what we need.
No, it's longer than a quarantine period, but I believe even for records retention,
10
it has to
days,
be a month.
yeah.
So it's
Good.
about 30 days.
That's
Alright,
great. So that's good at the middle school.
Good.
I think the options that are given need to really consider that if you're just going to offer a kid an option of sitting in a seat all in a corner by themselves at the middle school level, this may not be what the kid then decides to opt for, the student, excuse me, opts to decide for.
Right.
And it's very important that it's communicated to the parents what the options are, to the guardian, what the options are for that student, available to the student all the time. So that if the student opts to do something else, then their parent will know that's what they opted to do. But I think it's also, principal first. If it doesn't work there and it doesn't work at that level, then
Right.
comes to,
Yeah, I mean, and I am more than happy to talk to anyone about like a situation they're having or whatnot, but like some of the situations, I just don't have a good point of reference because I'm not in the school every single day to know, what's happening with this particular student or the particular lunch situation. And when you get into, again, I had mentioned this earlier, but you've got, say, a particular class, or if you have a student with a particular need or whatnot, I'm not the best person for that. The team that works with that student during the day is really the best, and I think they have made options available. I think students are availing themselves to those options. Some at this point, particularly, again, at the middle school, the high school level, might go through the line, get their lunch, and just go outside with a friend or two, and, eat, and they're very comfortable doing that. I don't know what the winter weather's gonna bring. Obviously, we're gonna have to keep an eye on that. But if people really do still have concerns, and again, I think there are a smaller number of concerns than we were previously dealing with. They're kind of one-off concerns that I think just need to be dealt with at the building level. Obviously, if it can't be dealt with, if people have concerns, call me. But I'm not saying I don't want to be the first call, but like I can't help in some of these situations without going through the school first. So I agree with you. Try to work your situation through the school. Make sure that the student knows what are the different options available to them. And again, it is tough because you may have parents that actually have one preference for what they want their child to do, and the student may want to do something different because their friends are there and, peer pressure and things like that can weigh in, particularly in middle school and high school.
yeah, the pressures are different.
They're different.
They are.
But I just think, make your building admin aware. Let them try to work through if they can, if there is still a concern. And, obviously, let me know if there's anything after that. But we're going to continue to monitor the situation. There are just very limited things we can do going forward to remedy this.
I think parents really also, I hope that the takeaway is, it's not just about the lunches, right, and spacing, but if if they're struggling with wearing a mask, if they're, feeling down because they're feeling, overly anxious about, COVID. I mean, it's everywhere. It's in the news and just, events in the world are overwhelming.
Right.
The parents should definitely reach out to the principals and let someone know so that we can, intervene.
The classroom teacher, I mean, like
Right.
whoever really has that relationship with the student,
Right,
reach out to them, a counselor, a building admin.
right.
Let them know if someone's struggling with something.
Yeah, anything, really, because I mean, there is a lot going on right now for kids. And I don't want to see any kid struggle unnecessarily with anything if there's something that we can do to provide some support.
Right.
Kind of, I know you and Linda were both in the buildings a lot when everything opened. What's the general feeling, how are the kids, how are the atmosphere?
Let me jump in, then you can. I mean, I would just say they're excited. Those first couple of days of school, we weren't really in the office much. It was just kind of being in the buildings and seeing what was taking place. Staff were excited to see the kids. I mean, the kids were just excited to see each other. And it was nice when we walked through to even just see, you know, to your point, Maria, like some of the technology that we'd installed. A lot of the teachers were using those interactive clear panels to do their meet and greets and different welcoming activities with the kids. But I think there was just a general, you know, kind of happy, you know, particularly at the elementary level. Not that the middle and high school kids aren't cute, but the elementary kids are just adorable. And it's great to see them, you know, kind of back in school. But
You
what
know,
was your thoughts?
I would say the same thing. I mean, there was a lot of activities planned and just getting to know you. Lots of people were running around. Just even reacclimating the kids to the building, taking tours. Like, don't forget, this is where you are. Because we talked about that, I believe, at the last meeting where, you know, even if a child had gone to the school before, it's been a year and a half, or perhaps they haven't been there. So you go from 5th grade to 7th grade, that's a big time, right? Time gap. So they were running around, bringing them, doing scavenger hunts. I saw the kids doing the scavenger hunts. So I think in general, everybody was just really in good spirits and just excited to be back in school. If the concession was just to wear a mask, well, then they're all happy to do that and chip in and, you know, just to have the kids in front of them. And the kids are pretty compliant. They, you know, even today, a couple kids coming off the buses, you just have to remind them, you're like, you just make a gesture, they're like, whoop, the mask goes right up. Middle school and high school students alike. It wasn't just the elementary schools being compliant. The kids just, they get it. And they're not fazed by it.
All right, anything else on the opening of schools? Okay, next is personnel.
Great. Yes, let me pull that up. Personnel report for the month of July. Cheryl in the HR office just provides us with a list of all the new hires and resignations, retirements, and then at the end of this, we did have a number of staff that changed assignments within the district. So it just gives you a sense of the comings and goings of the district staff as we get the school year started. We're actually going to do the August report at the next meeting. So you'll kind of see in July and August where a lot of the activity takes place. And you'll see a lot of additional kind of new hires coming on board in July. I'm sorry, in August.
There's a lot of activity happening in this office and, you know, in HR. Are they fully staffed now? Is that position already full, that additional analyst position?
No, they're not fully staffed, and they have interviewed for that position a couple of times. They're actually, they had recently, I don't want to get into too many details, but they'd recently done another round of interviews, and I believe they're very close to offering a position, but I don't know where they're at in the process. Obviously, we're in September, so you wouldn't see that on the next report, but I can let you know if that does get filled.
Well, I'm sure, you know, Dr. Patrick has been working very hard with all of our staff to get us through this craziness. And it has impacted people in HR tremendously.
Right.
I would just not want to see them get to the point where, you know, it's overwhelming and not being fully staffed themselves could lead to some repercussions. So if it needs to be revisited in terms of how it's all structured in there, you know, returning to us, I think,
So
just thinking
I'll
of
bring
them.
that to you. Thank you.
I know you mentioned them earlier, tutors, how are we doing? I know we have the extra tutoring positions.
I mean, we're still in the process of hiring, so we usually start with the interventionists and tutors, and Kelly Rogers has been fielding many of those interviews, and a lot of our interventionists have returned. Obviously, they can if they had school-age students, and now those kids are in school. So we're just, you know, making sure we have the amount that we have needed at each school, and then to see where we can build additionally more people to help.
I just didn't know how the candidate pool was.
You know, it's not huge, but it's also, like I said, we have a lot of returning interventionists that really just enjoy the job in general, so they've been actually contacting us. But we have plenty of applicants to choose from to help now with the next layer as soon as we get the first group in.
Okay, great. Anything else on personnel? Field trips.
Yeah, we have one field trip that involves two schools this evening, but assuming that we're able to travel in the springtime, we have the 8th grade students who enrolled in French at McCarthy and Parker to be eligible to go to Quebec City at the end of May. So this is a couple of overnight trip. Again, the itinerary is there. It would be open to those population of students who were the French students in the 8th grade at both schools. They'd be going together on this trip. So we'd seek your approval for that.
This isn't the field trip we had an issue with before, is it? Where they didn't get the money back?
That was at the high school. This is the middle school trip.
Yeah, that was a high school
Okay.
trip.
All right, so
But it's a similar dynamic, because I think they,
And if it was
were
the
they
same
going to
group?
Quebec too?
Yes, they were going to the same place,
Yeah.
different set of students, different company.
if a company, that's mainly was the company I was concerned about.
Correct.
It was a
It's not,
different
yeah, it's not the travel company, it was
Okay.
the bus company.
company. Okay,
And it's not our regular bus company we use, it was a different bus company.
Okay.
That's an important point that Dennis brings up, because I know that border crossings and so on are a problem. And traveling in and out of Canada, either US restrictions or Canadian restrictions because of COVID. So I would just want to make sure that any bookings that happen, anything that happens, to make sure that there's something in there that says, it's going to be refundable immediately or however, to anybody who puts money down, because the travel things do impact what happens at the border.
Yeah, no, I agree with you. I mean, this is a voluntary trip, and as we learned the last time, even though we have language in our policies, sometimes we can end up in disputes with companies about reimbursements. I think that was particularly telling during COVID. But, obviously, if a trip is canceled, we try to facilitate and work with the families on reimbursements. This particular company, it was very good. There were like two major companies during the pandemic that had issues. This was one of the ones that either allowed you to kind of carry your fee over to like a later year if you wanted to go to a trip, or they would refund. I think there was a small cancellation type fee, but it wasn't significant. The issue we had was with the bus company. That wasn't part of this particular trip.
Okay.
And that still hasn't been resolved. We're still battling with them.
any other questions on the field trip? Okay, we'll take a motion.
I make a motion to approve all the field trips as presented, or one of them.
Second. All right, any other questions, comments? All right, all in favor? Aye. Okay, 5-0.
Field trips are my favorite.
Thank you. I like a field trip.
All right, any liaison reports yet?
I did attend virtually the PTO meeting for the Harrington. They've started their agenda for the year, and they went over all their budget. They talked about, the events calendar for this coming year. They introduced board members, and they have upcoming their color run. So I'll have more details about that in the next meeting, but that's all starting to roll.
Okay, anybody else? I know the PTOs are starting to post their dates and all that. I know I got center schools. I think the first one's the 29th, so.
Yes, very
They
nice.
should be starting up soon. Okay, anybody have any new items?
I think Jonas, you have
Oh,
one.
yeah, just the one, because, that October 1st, I
that's
just
right.
want to make sure that we're, we've come thinking about what we're going to do.
Okay, I would like to ask if, I'm sure you're planning to do this at an upcoming meeting, but I do think we need to look to see how classes are in terms of their sizes and so on, and our enrollment, and how that's going. And then my other question is, I really am looking forward to our student reps coming on board, and just wondering how we're structuring that, and when they'll be able to join us, and how, here in the room, and so on.
So on the first thing, we will be taking a look at class enrollments and sizes. I'll be putting a report together for that. On the student reps, I haven't quite figured out what we're going to do in the room with them yet, but I'll personally reach out to the two of them before the end of the week and schedule a time to meet next week and talk about kind of transitioning back into coming to the meetings. I don't know if offline we want to have any discussions just around what we think the best seating situation would be, but maybe we can talk offline about that, and if they're available, plan to have them come to the next meeting.
That would be great.
All right, anybody else? I just want to throw this out there, that probably not for the next meeting, but at this point in the year, we're usually starting to work on goals and things like that. There's a couple of extenuating circumstances. Once we still have a workshop to do, and I think stuff will come out of that workshop, particularly in terms of professional practice for the school committee. Most of our goals this past year were COVID-related, or just getting us through COVID, and unfortunately, it's not completely away yet, so we're still gonna have to deal with that. And then thirdly, we still have to work out something with strategic planning.
Yes.
And I know we're still working on getting the company in here. And hopefully we'll have some information on that next meeting, but, so, you know, yeah, I usually try to go back and look at what we've done in the past. Usually at this point of year, we're either coming up with the goals, finalizing, but, you know, it might be maybe better to wait maybe till the end of October or something to try to get all those other things under wraps, and then we'll start working on those.
I
Both
think
us
you have
and
that
for-
workshop first.
Yeah,
Yeah.
oh, absolutely, you know, but even to get the strategic planning,
Yeah,
company.
I'm hoping the strategic planning, and again, this has just been, there's a lot of behind-the-scenes work taking place, but I just need to let that play out before I really kind of present something to you. But I'm hoping that's in short order. So, I mean, that could be the focus very soon. Aside from that, I do think a good portion of that meeting on the 28th is going to be around, you know, kind of coming up with mutual goals for, you know, admin and school committee for work for over the course of this next year, particularly in the frame of, you know, we're not quite out of the pandemic yet, and we want to go. So I think we could recirculate what we currently had in place, and kind of that will be a work session. We could talk and just kind of see what comes of that. And then I think in relatively short order, early October, be able to kind of finalize our goals for the year. But I think that workshop would be very worthwhile to have.
Yeah, just wanted to throw it out there, because I know, you know, at this point, we're usually rolling on that, so.
Right.
All right, anything else? Okay, any additional public comment that people received they want to share? All right, I will take a motion to adjourn.
I make a motion to adjourn.
All in favor? Aye. 5-0. All right, thank you.
Thank
Thank you, everyone.